with the men, of course, 50 is the magic age, and that's when most of them will see urologist for the first time, because you're going to start prostate cancer screening. And prostate cancer screening is accomplished through a blood test, a PSA, prostate specific antigen, which is normally produced by the prostate in low amounts. So when it gets elevated, we kind of get a little concerned. That being said, there are many things that can cause a PSA elevation, including infection, prostatitis, urinary retention. A lot of times, the patient just had sex before they got their PSA checked, and it goes sky high. And then I know it's not. I know it's not uh, true. So I tell them, okay, next time just give it a little break before the test, and then we'll try it again. Um, but with that being said, the reason PSA screening is so important is because prostate cancer is virtually asymptomatic. If you have symptoms with prostate cancer and you're coming to
Too
see,
late.
it's already very far gone, because you shouldn't be having symptoms. It's usually very localized. So, PSA is one part of the picture. And then we have prostate examination, which is another part of the picture. And then these days we employ more and more MRIs, which we use to screen for suspicious lesions. Even though it's not 100%, it's a really good screening tool. But ultimately, the most definitive way you're going to get a diagnosis is a prostate biopsy. So typically, by the time men have seen me, they've had PSA elevation, and it's always important to recognize that you don't just go off one and get very excited. Usually, they'll see a PSA elevation, and if it's just a minor elevation, we'll check again. Even if it's a major elevation that doesn't seem to correlate well, we'll check again. But if it shows a steady trend upwards, then you see me, and then we basically plan for what are you going to do? Do you want to check your PSA again? Do you want to go straight to the MRI? Or do we want the biopsy? And patients who elect for biopsy, a biopsy is much less involved in a colonoscopy. So that's how I preface my talk with the patients. At my particular location, we do it under sedation, which a lot of patients appreciate. And it takes all of 10 minutes. It's just an ultrasound probe in the rectum. I'm able to measure the prostate. And then I take 6 samples from the left, 6 samples from the right, and then we're done. Patient doesn't even remember that they had the procedure. And it typically follow up in about 2 weeks, because we're not going to get any instant results. We send it to the pathologist, and then they give us the results back. And otherwise, there's always a small risk of infection, but I haven't had one yet, knock on wood. And then there's some bleeding in the blood and the stool that happens afterwards. So nothing major. I tell patients to do it very often, and then once we know what we're dealing with, we know what direction to take.